Hello friends, today we will be talking about 5 simple tips which will help you in becoming pregnant in IVF cycles. So these are very 5 simple things which I think all of you should follow. So as we all know that IVF is not always 100% successful. There are positive results and there are negative results too. Some patients, they have about 50% chances of conception, while others may have 35%, and there are very few couples, those who have just about 10% chances of conception. So the first tip is to have a positive approach. So you should always think that you are getting your treatment done, the doctor is doing its best, and your result will be positive only. Because I have seen people, those who come with a negative attitude, and they are stressed out throughout their cycles, and mostly they end up with negative results. I will give you one example. We had a couple who needed IVF, and so when we advised IVF to them, they were really saddened and disheartened that why they had to undergo IVF. There are couples, those who conceive naturally on their own, and so they will have to spend money. They will need so many injections and so many multiple visits to the clinic. And then if at the end the result is negative, what will they do? So we explained everything to them, and they underwent IVF, and unfortunately they did not conceive in the first cycle. And then we told them to go for the second embryo transfer only when they come with a positive attitude. And so they came to us about 3 months later, saying that they are ready for the next transfer, and this time their result will be positive only. And believe me, they conceived with twins, and they are now proud parents of 2 children. So your attitude towards your treatment will really matter in your success of the IVF. Second important tip is to have a holistic approach. Means you should have a very good lifestyle, healthy eating habits, and your sleeping pattern should be good. That is, that you must sleep in time, get up in time. You should not be sleeping very late and straying with your mobiles. The screen time is more, and you should be inculcating yoga, meditation and exercise in your daily routines. Then taking of supplements like vitamin B6, B12, vitamin D, omega-3 fatty acids and coenzymes should also be introduced into the diet. And normally we tell our patients to start these supplements 2 months before the IVF, because the egg and the sperm which we are going to use in the IVF is recruited 2 months prior in the body. So we tell the patient to eat fruits, vegetables, nuts, and avoid fried and junk food, and to exercise daily. And the male partner is advised to avoid alcohol and to quit smoking, and so that we get the best of the egg and the sperm, so that very good embryo is formed and the chances of success are really improved. So all the couples undergoing IVF should follow this. And the third important tip is to choose a good fertility clinic or a fertility center, because they should have all the advanced techniques and a very good IVF lab. And then you should see that you are given a personal touch in that clinic. You are just not a number for them. You should be able to clear all the doubts and to ask whatever question comes into your mind, maybe even if it is a silly question. So you should have a personal equation with the doctors over there, and see if the fertility clinic is good, they will have a very good IVF lab, and as a result they will be choosing a very good stimulation protocol for you. As a result, your embryos which are formed will be good, and the result will definitely be positive. So we have to actually individualize every patient. There are patients, those who will need fewer injections, and they might need injections just for 10 days, while on the other hand, a patient who is more than 35 years of age and is overweight and whose hormonal status is not good will need more injections, and the number of days of injections will also be more, maybe 12 days or so. So we can't just put all the patients in one basket. So individualization of the patient has to be done. And the fourth important tip is to never compare your IVF treatment with the other patient. We get couples coming to us telling us that they know somebody, a female who was 48 years of age, and she underwent IVF with her own eggs and she conceived in the first cycle. At about 48 years of age, undergoing IVF with self eggs or with own eggs, the chances of success are less than 1%. So couples, they don't want to they disclose that they had used donor eggs or donor sperms. They want to keep it a secret. So you should keep a practical approach. So I mean, if the couple doesn't want to tell you about these things, I mean, it's not necessary that you should know everything about them, and you should just follow your treatment and hope that your treatment will be the best. And as it is, 25% of the success is in the hands of nature. After the embryo transfer is done, there is a crosstalk between the embryo and the endometrium, and after the crosstalk there is implantation, and for this implantation to happen, the implantation window is very important. This is a point where the doctors, they are not able to do anything. That is, once the embryo transfer is done, it is how your body accepts the embryo, how the implantation occurs. And so you should always think that the doctor has done its best and your result will be positive. And the fifth and the last simple tip is to always hope for the best. You should think that you are getting your treatment done and it will be positive only. Because the positive attitude, as I told you earlier, it really helps in the success of the IVF. Because if your one cycle fails, you should not get disheartened, because there is always light at the end of the tunnel. We've seen that couples, those who keep on trying, almost quite a number of patients, they at the end always conceive. Only very few patients whose uterus is really bad, like they are full of fibroids, and or the ovaries of the female are really not good and she doesn't want to use donor eggs. Otherwise, almost all the couples, those who keep trying, they conceive. So I would advise all of you to don't leave your treatment, don't be disheartened with one IVF failure. If you keep trying, you will definitely succeed. So in the end, I would like to tell you all that you will all become parents from patients, and I would like to wish you all the very best to all the couples.